Hi, Christian. Hello, Priscilla. Hello, Susnede. And Susnede, it's nice connecting with you again. It's been a while.
Hello, how are you? Thank you very much.
Yeah, I'm doing fine. I'm doing very, very great. Okay, I think I can see Muyosore to join in. Hi, Muyosore.
Hi, good afternoon.
I can see people asking me for links, so signs of people that didn't register. Yes. Okay, sir.
Goodness, Chris,
Yes.
can you mute yourself?
Oh, sorry. I'll mute myself shortly. Sorry, please. Okay, so I think we have a good number. I think we can start out now. Amifel, are you on the call?
Hello, goodness. Yes, I am here. Can you hear me
Okay,
clearly?
great. Yes, I can hear you.
Okay. All right. Good afternoon, everyone. You are welcome to today's session, today's monthly industry insight series. As always, we have a lot packed for you. So, like I always say at things like this, if you're here right now and your friends or even your enemies are not in the call, kindly tell them to join in because we are about to begin. Just as Just as goodness has mentioned, my name is Ami Phil. I'm the communications lead at ASN, and I'll be your host for today. Without further ado, let's begin. I have a few people on the call. We still want more people to join. But while we wait for them to join in, I always like to get our expectations at sessions like this. So I'll just take about 2 people just to tell me what your expectations are for today's session. So anyone can go. Just to tell us, what your expectations are. Or if you really just want to hear from the speaker, that's fine. Okay, we have James. James, you can unmute yourself and speak.
Hear me? Can you hear me?
Yes, I can, James. I can.
Okay, good. Yeah, so my expectation is basically to learn more about like the fintech industry and also like to understand like, the career opportunities, like the trends, and how we can basically contribute to these central to the African continent and even on the global landscape.
Okay, thank you very much, James. I'll to take one more person, maybe a lady this time. So would a lady like to speak, or would you guys want me to just call a random? So if you're a lady and you're on this call, kindly speak. Just tell us what your expectations are for today's session. Okay, it looks like you would want us to call it random. Okay, I have a lady, Damilola. All right, please unmute yourself and speak.
Yeah, hi everyone.
Hello, Dami.
My expectations from this particular series is this particular session is how to actually build a career in health technology as someone who is interested, passionate, but is currently, let's say, in another field currently. Like the person does not have an exact background in health, but wants to contribute to the health tech sector.
Okay. Thank you very, very much for that. Thank you. At sessions like this, I always encourage that, when it's time to share or give a comment, please feel free to speak. Never feel like you don't have the right thing to say, because most of the time you probably do. You might not phrase it the right way, but you deserve to be heard, and you should always, opt to speak at sessions like this. So thank you to our speakers, James and Damilola, for speaking. So I think we can officially begin today's session. For those who might just be joining us for the first time, like if this is your first monthly industry insight series, you are most welcome. And if this is not your first, thank you for joining us once again. But to just take a quick insight into what ASN is all about, we have an About ASN video that would play right now for us to just get to know what ASN is really about. So if the video is ready, please, that can go on.
I'm so sorry about that. So it's so glad to have you all here and to be given the opportunity to give a brief overview of what African Students Network is all about. My name is Damilola Alimi, and I am the programs lead at African Students Network, ASN. So before we eat it right into this presentation, I would like us all to first picture a vibrant, bustling city in Africa where dreams are like very, very big. So if you ask me, I would say Lagos. So let's just quickly take this brief story about a good friend of mine that lives in the city of Lagos, Amina. Amina is the kind of person that has like a grin that could light up the darkest room and a determination that could move mountains. Now, looking through Amina's journey takes us through our adventure in our final days at the university. Our graduation cap, our diploma is at hand, and everyone says the world is our oyster. But guess what? Amina, like so many of us, finds herself doing the ultimate head scratcher dance, the one where she's looking at job listings, asking for many years of experience for an entry-level position. I guess that sounds really, really, really familiar to every one of us here. So, moving on, youth unemployment is a major challenge in Africa, with the International Labour Organization, ILO, reporting that more than 60% of unemployed people in sub-Saharan Africa are under the age of 25. I guess from Amina's brief story, we all know why this is true. Now let's hit a pause on Amina's story for a moment, and let's go right into the presentation on what we intend to achieve at ASN. So at ASN, we are looking to solve these problems through our extensive career and leadership programs aimed at equipping African students with the needed knowledge to be active competitors in the labor market. So introducing ASN, I would say African Students Network is a confluence of intellectual individuals targeted at raising indigenous African minds that are self-driven, motivated like Amina, and can leverage this circle to develop, grow, and improve their expertise to make sustainable impact in their career, in leadership, and to become major change makers in the next few decades. So our vision at ASN is to equip African student leaders for global relevance, central to career development, talk about entrepreneurship and leadership. And we intend to do this by building a viable network of change makers among African students across diverse cities, countries, universities, and within and outside the African continent. At ASN, how do we intend to achieve this? We intend to achieve this through our 5 programs. The African Students Accelerator Program, which we refer to as ASAP. So ASAP helps African students get exposure to cutting-edge soft skills that will set them apart in their frontiers of interest, building general soft skills and leadership skills, coupled with ensuring that they are competing in the corporate workspace. So joining our accelerator program gives you an edge over every other students in the labor market. Then the second one is going to be the African Startups Foundry, ASF. So if you're interested in building startups, ASN could be where you can find your next co-founder. ASN gives you everything you need to know the nitty-gritty of building a startup. African Social Impact Program. I'm very sure a lot of us would want to, should I say, build non-profit organizations and make social impact in our community and the world at large. The African Social Impact Program is for those interested in building various backgrounds such as finance, engineering, to give more directions. We get to learn and network with these speakers. And finally, our monthly webinar series, which of course is taking place now, the first. And this cuts across various topics, bringing speakers doing amazing things, just like the current one. We have Timilade Adelakun. She'll be speaking with us for a while. I'm beginning a lot from her. So through this program, we intend to bring together African students, equip them, enable them discover themselves, build entrepreneurial mindsets required to build cutting-edge solutions for indigenous and global challenges. Thank you very much. Ensure you stay up to date with our various activities through our email, LinkedIn, Twitter, and Instagram. Once again, thank you very much for listening to me.
Thank you very much, James, for sharing that. Please confirm that you can still hear me clearly. Just anyone. Okay, thank you so much, Emmanuel. All right, so that was a brief into who ASN is. So let's go into what we have for today. So for today, we're looking into, insights on a career in healthcare technology. And to walk us through this, we have an amazing speaker for today. Before she, takes the floor, I'd like to read her bio. Dr. Favor Ogedegbe is a pharmacist and health tech innovator developing digital and community-driven solutions to close gaps in medication access, care delivery, and health infrastructure across underserved African communities. She blends digital product design with frontline health delivery to build tech that actually works for those sidelined by conventional healthcare systems. Favor has led initiatives spanning mobile medication platforms and reproductive care programs reaching over 6,000 people in low-resource settings. Her work has been supported by institutions including the Bill and Melinda Gates Foundation, World Skills, HP Foundation, MIT, and Co-Creation Hub. She builds human-centered technologies that strengthen care systems and extends access in places where traditional infrastructure falls short. Drawing on field experience and a systems lens, she designs tools that are practical, intuitive, and responsive to the realities of the communities they serve. Ladies and gentlemen, I present to you Dr. Favor Ogedegbe. So please, with show of emotions and reactions, let's welcome our speaker for today. I'm always so excited to have ladies come on board and speak to us. So pardon me if I sound super excited. Dr. Favor, you have the floor now.
Okay, good afternoon, everyone. It's
Good afternoon.
absolutely fantastic to have you here, to be here today with the African Students Network. I'm Favor Ogedegbe, and I'm genuinely excited to connect with each and every one of you today. So I would be sharing my slides. Okay, yeah, it is right. Okay, I guess you all can see.
Yes, it's clear. Dr. Favor, it's clear. You can go ahead.
Okay, all right. So we are going to be talking about a very important topic, which is a career in health technology. Okay, so now before we talk about what health tech actually is, I want us to take a moment to connect. I don't want this to be a passive lecture where I just do the talking. I want you to engage with me. So I will be asking you a few questions. So the first question is, let's be honest with each other. Have you ever experienced a time in your life where you waited for long hours in the hospital? Probably you weren't feeling too well and you had to go visit the hospital. Either you had to skip work or school to visit the hospital, and then you had to wait for long hours at the hospital. So if you have ever experienced that, just type a yes in the chat box, please. Okay, I can see 2 responses. 3 now. So it seems like each and every one of us have experienced this before. Okay, so have you experienced a situation where you needed a medication and it was out of stock in the pharmacy or probably in the hospital, and then you had to move from one pharmacy to another in search of that particular medication? Okay, we have all experienced it. So I'm seeing lots of yes. So this means that we have all experienced these struggles in our day-to-day life. So do you ever feel like the healthcare in Africa is broken? Because most of the time when you go to the hospital, you have to stand in long queues, you have difficulty getting reliable health information. Do you ever feel that way? So there are so many yes. So that means that each and every one of us has felt this frustrating experience before. And that's one of the reasons why we are here today. Our healthcare system is not failing because we lack enough healthcare professionals. That is part of it. But it's actually failing because we lack innovative people like you and me who are trying to build new ways of doing things, who are trying to design better systems and to solve problems using technology. And that's why we are here today. Today, we are going to be talking about a career in health technology. How do you get into this field called health technology? How do you navigate it? How can you use your existing skills for this particular career in health technology? I don't know if you can still see my slides.
Yes, we can.
Slides.
Yes, we can. I can still see.
Okay, all right. Seems like my network is slow from here. Okay, so these are the things we are going to be talking about. We are going to talk about what health technology is, why health tech matters, the skills and the education that you need, and the future of health technology in Africa. So when you hear health tech, box, what's the first thing that comes to your mind when you hear the word health technology? Or someone could unmute themselves and actually respond. Hello, is anyone here? What's the first thing that comes to your mind when you hear the word health technology?
I think
I think someone dropped a comment.
a combination of a combination of like health and technological tools to kind of like improve or optimize like the processes.
All right, that's correct. Someone said health and technology enhancements. That's also correct. So I would just okay. Does
Manuel,
somebody else?
go ahead.
Yeah.
Emmanuel, you can go ahead. Your hand was up.
Yeah, good morning. So I think the first thing that comes to my mind when health technology is mentioned is the um processes and tools that helps the, let's say, frontline workers do their job better. So I think it can cost across labs, hospitals, and yeah. Thank you very much.
All right, that's also correct. That's also correct. So health technology, in simple terms, in a layman's English, so everybody can understand, is simply using technology to make people's life healthier and to improve healthcare, to manage health information better. So it's where the smart ideas from engineering, computer science, data analysis, and design come together to solve everyday health problems. So it's about using clever tools to make a big difference. And in health technology, there are different elements or different components in health technology. And one of the components of health technology is medical devices. So medical devices, you are thinking beyond the simple doctor's stethoscope. We are looking at amazing machines like MRI scanners, which help to take detailed pictures of organs in the body, life-saving pacemakers that help your heart beat regularly, complex surgical robots that can actually help doctors to perform surgeries with extreme precision, and also smart prosthetics systems like artificial parts of the body that can even respond to thoughts. So these are wonders of engineering that are being designed and built by brilliant minds. We also have digital health and telemedicine.
Hello,
I
Dr.
think,
Silva.
yeah,
Okay.
yeah.
No, we lost you for a bit. That's why I wanted to get your attention.
All right. Okay. Can you hear me now?
Loud and clear.
All right. So we also have medical devices. So can you see exactly where my slides are now? My slides are in key elements. Can you see that on the screen?
What I can see on my end is overview page that has,
Okay.
Oh.
yes.
All right. So I've actually moved from that slide a long time ago.
So can you stop sharing and reshare again?
All right. Let's see if that works.
Yes, we can see the key elements page now.
Okay, so better. All right, so okay, so the next thing that we have here is, as I was saying, digital health and telehealth. This area is actually a huge area for Africa because it uses the technology that we already have, such as our phones, our tablets, our internet, to give people health services. So under telehealth and digital health, we have telemedicine. So this is just like using like calling a doctor either through video calls or chatting with the doctor rather than going to the hospital. So it saves you the long, expensive journeys to go to the hospital, losing your day's work. It saves you all those stress. Then we also have mHealth apps. The M in mHealth stands for mobile health. These are apps on your phones that help you to track probably your blood pressure, your blood sugar level, menstrual cycle, pregnancy. There are so many other apps like fitness apps, nutrition apps, mental apps, and the rest of those. Then we also have health information technology. So I don't know if any of us have been to the hospitals recently. You would notice that they no longer use papers. Everything is now computerized. Have you experienced that before? Have you noticed that before? If you have, you can just react. Yes, exactly. So everything right now is computerized. So that's why we call the health information technology, we call it the digital brain of healthcare. And this is made up of EMRO and EHRO. So EMRO are called electronic medical records, while EHRO are called electronic health records. EMRO are slightly different from EHRO, in such a way that for the EMRO, you can only use it for a particular organization. You get, let's say I go to hospital A to see the doctor, and then tomorrow I want to go to hospital B. My medical history can only be seen in hospital A because they are using the EMRO system. But for the EHRO system, it's like your medical records are transferable. So if I go to hospital A, B, C, and D, doctors from the other hospitals or lab scientists or pharmacists, they can see my medical history from all those other hospitals I've gone to. So this actually makes it easier for medical professionals. And then we also have the biotechnology and informatics aspect. This is where the amazing world of biology meets with the power of technology. So it involves using smart computer programs to analyze biological information like your DNA, understanding disease risks, understanding like how to discover new medicines and vaccines, and even speed up the discovery of new medicines and vaccine. So we are going into a future where there will be personalized medicines, where treatments are literally designed for your unique body and your genes. Then we have artificial intelligence and machine learning. So I know then when we usually watch all these science fiction movies, we'll be like, oh my God, this is film trick. It can never, ever, ever happen in real life. But I'm telling you now that in the next few years, everything that you see in the movies would be a possibility using artificial intelligence and machine learning. That is how powerful it is. So in the healthcare system, it involves using powerful computer programs to help doctors to diagnose diseases faster and more accurately from medical images such as X-rays, MRIs, to predict disease outbreaks, to identify which patients are actually at risk, and even help to discover new medicines quicker. Then we have the assistive technology, we have genomics, which is it's like taking a deep dive into your body's instruction manual, which is your genes. So genomics actually uses unique genetic information to help to guess the risk of disease condition, to get accurate diagnosis, and to create personalized treatment plans. So it's an amazing field that is emerging, and we are actually looking at what it can do. The possibilities are enormous. Then we have wearable devices, like using your smartwatch to check your heartbeats. So imagine being able to monitor your blood pressure and all of that using a smartwatch. So that's what wearable devices are basically about. So the next question is, why is technology important globally and in Africa? So technology is actually very important globally because it helps to diagnose diseases faster, it helps to treat more precisely, it empowers patients to take control of their health, it helps to deliver care remotely, saving us the stress of waiting in long queues, and also helps to handle massive amounts of data and make systems more efficient. So in Africa, let's bring it now to to Africa. Why is health technology important in Africa? So I want you to think about the unique challenges that we face in Africa, such as managing patients' records. How do we track disease outbreaks? How do we manage patient history? How do we ensure that there's continuous inflow of information? How do we ensure that the healthcare system actually bridges the gap? The way we can do that is to use digital systems and also to use mobile health applications to provide real-time data and actionable insights. Then also, if you know, in Africa, the data management, especially for various diseases, is very, very poor. So having digital system would actually enable organizations to be able to make smart decisions, because when you have data, you can predict, oh, this disease is going to happen in so and so years time in this particular community, because you have data of patient history, so you can track disease outbreaks. Then also there's a rising burden of non-communicable diseases. As our lifestyle changes, we are seeing more chronic conditions like diabetics, high blood pressure, and cancer. So how do we manage this effectively? Technology is the answer. So these are some of the reasons why health technology is actually important in Africa. So let's go to the main reason why we are here today: careers in health technology. So I'm sure you are thinking, oh, this is amazing, but what can I actually do? Where does my skills actually fit into this field? Okay, I hope you can see my slides clearly now.
Yes, we can.
Okay, so where does my skills actually fit into this field? So the beautiful part about health technology is that it's a mix of different fields. Like, whatever skills that you have, you can actually integrate it into health technology. So you should be able to understand some technical aspect of health, the medical needs of the people, what the people actually need, and how they live their lives. I think that this is one of the most important part of building healthcare systems, because if you don't understand the people's needs, or let's say you understand the problem, but you do not co-create with the communities, at the end of the day, you end up providing a solution that you think would work for them, but would actually not work. So an important part of building health tech systems is that you co-create with the community, you do focus group discussions, you do community mappings to actually understand the community and the community needs. So one of the fields in health technology is tech and product development. So if you love building physical things, if you like to design how things work, you like creating tangible products, then tech and product development is definitely for you. So imagine being a biomedical engineer, where you'll be designing and developing medical devices. This could be simple devices like artificial limbs to advanced X-ray machines, or even tiny tools that can help with surgery. So you are literally engineering these tools to help people's body work properly. Or you could be an hardware engineer rather. So if you are an hardware engineer, you focus on the physical parts of medical devices, like the tiny sensors in a smartwatch that helps to measure the heart rate, or electronic systems in the hospital. Or you could even be a robotics engineer. So robotics engineer, what they do is that they develop robotic systems. So right now, I think there is a new innovation where there are robotic system that helps to carry out surgery. So they help doctors carry out super precise surgeries. Then you can also develop systems for the pharmacy that help to automate the tasks in the pharmacy and makes it faster and safer and easier. Then if you love creating computer programs like apps, digital platforms, or making technology easy and useful, then you could go into software engineering, or you could become a developer, a software developer. So here you are building health apps that uses phone, you are building complex electronic health records, you are building advanced telehealth or telemedicine platforms that helps patients to connect to doctors. And you could also build AI tools that help doctors to diagnose diseases. So these are the fields in tech and product development. So the next is data science and analytics. So if you are fascinated by data, you like finding patterns, you like making predictions, you like turning raw numbers into life-saving insights, then data science and analytics is for you. So in data science and analytics, you could be, or you could take a career in health, in data scientist, or become an analyst. So your job is to collect data, to clean the data, and to understand huge amounts of health information. So your goal here is to be able to spot trends, to predict disease outbreak, to see if the treatments are working, and help make important health decisions. So I usually say that people in this field are like the detective of health information. Then the next on the list is bioinformatician. So this person specializes in analyzing huge amounts of biological data, especially information that has to do with our genes. So they help to understand disease better and help to develop new treatments. Then we also have machine learning engineer. Here you are building AI programs that can help diagnose diseases faster, that can help predict how patients might recover from a particular disease, that can speed up the discovery of new medications, or even create personalized treatments for individuals. Then the next career path is health informatics. So if you are interested in managing computer systems, in making sure that everything runs smoothly and securely, then you could be looking at a career in health informatics. So I feel like in Africa, we really need digital people in the digital system and infrastructure area. What these people do is that they develop and they maintain computer systems and network that support healthcare systems. So they keep everything running behind the scenes. Then we also have clinical informatics. These are people that bridge the gap between how medical professionals work and how technology actually help them too. So it's like they are the connection between medical professionals like doctors, nurses, and they actually help to make sure that technology is used in the best way to improve patient care. Then the next on the list is health records and patient administration managers. So what they do is that they manage the complicated patient records. They make sure that health information is collected correctly, securely, and can be found when needed. Then we also have specialized fields like nursing informatics. Nursing informatics is like combining nursing and IT knowledge together to improve care. Then we have population health informatics. So this basically uses data to improve the health of the entire group of people, like an entire population or community. Then the last but not the least, you could go into business or policy. So if you have an entrepreneurship spirit, you like to solve problems from the business angle, and you also like to drive innovation, you could go into this area. So you could become an healthcare consultant. So an healthcare consultant basically advise health organizations and new tech companies on how to use technology wisely, and also make sure that their systems are digital. Then you could also become a product manager. So a product manager is basically in charge of the development of technological products for healthcare from the start to the finish. So they are in charge of figuring what people need, getting the products made, launched, and making sure that it grows. Then you could also become an health tech entrepreneur or startup founder. So these people are people with big visions. They see a problem and they want to build new technology, or they want to improve existing technology. So I would like to ask a question now. So from everything that I've said, has anyone gotten an idea for an health tech company? You can just react with an emoji or the reactions. Hello.
I am with
Okay.
you.
Okay.
We're
I'm
with
just
you.
getting.
People are addressing their
Okay.
reactions. There you go. Yes.
All right. Okay. All right. So I want to tell you that whatever idea that you have is actually not too small, it's not too big, it's not impossible, it's actually possible. I'm a firm believer that nothing is impossible. What you just have to do is to put in the work and ensure that you bring that idea to life. And this is why I'm going to be giving you essential skills, the skills that you need. So the skills that you need in this incredible pathway that we have been speaking about. So firstly, you need some foundational skills that are very, very, very important. And one of these skills is you need to have strong problem solving skills. Okay, I guess my slides aren't moving. Okay, so sorry about that. Can you see my slides?
Yes, but it's still on the business and policy page.
Business and policy page.
Yes.
All right. All right, so I'll stop presenting and join again. I guess network from my end is really bad.
All right, that's fine. While she sets that up, if you have your questions, start noting them down. When it's time, we'll take them. You can either unmute yourself or you can drop it in the chat when it's time. Okay.
All right, so what are the essential skills that you need in this pathway? Like I was saying, you need some foundational skills for you to be successful in this career. And the first is you need to have strong problem solving skills. This is the ability to look at a complicated health issue and figure out what is happening and come up with smart and practical solutions. So it's about thinking clearly to solve really tough problems. The next skill that you need to have is critical thinking skills. So this involves you looking at an information very carefully to notice if something might be biased in order to make smart decisions. Then you should have excellent communication skills, then adaptability and long life learning. Now, there's a saying that life is a learning curve, which is very, very true. And for health technology, it's even very, very true, because this field is a field that actually moves very, very fast with new technology, new diseases, new solutions every single time. So you must be someone that loves to learn. You must be someone that loves to research, because things are going to keep changing. Your knowledge is going to keep changing. So for you to be successful in this field, you should love to learn and research. Researching is very, very important. So at the end of the day, you are not left behind. Then you can also learn some technical skills depending on the area that you would love to go into. Some technical skills such as Python. Python is really great for data and AI. Arrow for analyzing data. JavaScript for making websites and phone apps. Then data analysis tools like SQL. SQL is used for managing large databases. Excel is used for organizing and understanding smaller amounts of data. Then powerful visualization tools like Power BI and Tableau. So these actually help to turn data into easy to understand charts and graphs. Then you should understand the data management, then also cloud computing platforms such as Amazon Web Services and Google platforms and the rest of those. Then also you should also understand cybersecurity principles. This is very, very important to prevent hackers from hacking very sensitive patient information. Then you should also understand like the terminologies used in the healthcare sector. Okay, so now that we have spoken about all of that, where do you start? How do you get into this field? So one of the ways you can get into this field is through a bachelor's degree. You could take a bachelor's degree in biomedical engineer, computer science, data science, health informatics. Or even if you don't have backgrounds in that field, you can also do your master's in those fields. You can do a master's in health informatics, biomedical engineering, public health. I listed some universities that you can look up for those fields. Harvard University, University of Toronto, Stanford, and there are so many. Then you could also take certifications. I think this is very important, especially for individuals that do not have knowledge in these fields. So you can take certifications from Coursera, from Udemy, from Microsoft Learn. Then you could also attend boot camps. Now, this is a very excellent way to actually learn, especially the technical skills such as coding, data science, and AI. So you can explore options such as She Codes Africa, Health Tech or Data Camp. There are so many options. Then also you could also have a clinical background, like I am a pharmacist. So you could be a pharmacist, a nurse, a doctor, or any other medical professional. So how do you transition into health tech after studying a medical course? So how you do this is to learn IT, to take certifications, to learn, like if you are interested in a particular field, you can start taking certifications in that field. It's also very important because medical health professionals, they understand the field much more better. They understand how things work. So integrating your medical profession with health technology would actually give you an edge. So I'm sure that you are already fired up and you are like, excellent, this is amazing, but where do I start building from? So these are some actionable steps that you can actually take. First and foremost is to connect with people in the field. Now start building your network. Follow health tech professionals, follow companies on LinkedIn, join relevant conferences, meetings, connect with others, and start working. Like build, I always tell people that they should not build in silence. You're supposed to build for the public to see. You need to be visible, because if people don't know what you are doing, then they cannot recommend you for things. Let's say, for example, a pharmacist, I'm transitioning into health tech, and nobody knows that I'm transitioning into health care. Nobody knows the things that I've done. Then nobody will be able to say, oh, she actually does this and recommend me for this particular role. So it's very important for you to build in public, because it makes you very, very visible. And visibility in 2025 is very important. Then you could also join hackathons or challenges. That's if you also want to be an health tech innovator, or someone that comes up with a startup idea. So some of organizations like UNFPA, MTN Pulse, and others are available, so you can join those. Then, depending on the field you want to go to in health technology, you can learn a technical skill. Like I said before, Python, Excel, and the rest of those. Then volunteering in an health tech setting. I feel that people underestimate the importance of volunteering. Volunteering is very, very important. I can say that majority of the opportunities that I got, I started volunteering when I was in uni. So it actually opened my eyes to so many, like it opened my eyes to so many things. It opened my eyes to personal development. It made me know that there's actually something outside the four walls of this school. So that's what volunteering does. It doesn't only open your eyes to opportunities, it also gives you a portfolio. So let's say, for example, you take courses in product management, like you have all the certifications, but you don't have experience. So what most recruiters look at is the fact that, oh, you have taken certifications in this, but you have experience in this area. So also, you could also try to like build a simple app, a dashboard, or something. It could be a medication reminder system, something to track common illnesses. You could build a chat box. Also, that's if you are going into the tech areas of health technology. Then you can also take online courses. So the opportunities in Africa are actually immense. And the reason why this is that we are a mobile first and young tech savvy population. In Africa, the mobile penetration is about 50%. So if we would actually decide to take advantage of what we already have, then it's going to be amazing. Just imagine what we did with mobile banking in Africa. So we jumped over traditional banks and see how amazing it is. And that is exactly what we are also doing in the health tech sector. Then also, there's an huge unmet needs in Africa. Like we have a very fast growing population, and there are so many needs to be met. Even if this is a challenge, it's also a massive opportunity, because you have the opportunity to develop health tech solutions to solve these problems. Then also, there's a local rise in innovation. We are seeing so many incredible health tech entrepreneurs from Africa. We are seeing engineers, we are seeing clever people who are developing brilliant solutions. And this is where the idea of solutions for Africans and by Africans actually come into play. So yes, there are so many opportunities, but let's be realistic, there are also challenges. So some of the challenges that we face in Africa is data privacy concerns, integration issues, like how do we integrate existing health tech into the new health tech systems, then regulatory compliance and user adaptation. So there's still resistance from people. So how do we overcome these challenges? So one of the ways to overcome these challenges is to develop strong privacy systems from the very, very beginning. You can employ an expert in this area to ensure that you are not breaching any data security pathways. Then also co-create with communities. This is very important. Like I said before, it's very important to co-create with communities. It's not just about thinking about a problem and then creating a solution. No, you have to ensure that you are not copying and pasting solutions from other countries in Africa, because our problems are uniquely different from those of Western countries. So you have to create with the communities, ensure that the solution that you are actually bringing actually solves their problems. Then you can start small. You don't have to create this big gigantic solution. You can start small, get impact, and then start applying for funding. Then also education of patients and healthcare providers is also very important. So what are the toolkits that you need if you are really ambitious? The first is to master a niche. You can learn how to code depending on what area you want to go into. You should study regulation. You can join open source projects. You can find a mentor. You can also help design human-centered solutions, just like I've said before. And then for the business aspect, you have to understand how to make money out of health technology, depending on which area you want to go into. It could be for profit or NGO. Then share your work on LinkedIn, on GitHub, and portfolio sites rather. You need to be visible. Visibility is the key word. So before I wrap up this journey, as you can see, there's an area for whatever skills you want to go into. And health technology is not just about building fancy devices. It's about building healthier and a more prosperous future for our families and our communities and the entire continent. So it's closing the gap in care and empowering individuals to make informed decisions about their health. Now, this new part is very exciting. And for the African Student Network, it's an invitation to step up and be part of the powerful movement that is actually changing things in the healthcare sector and helping to solve challenges that people face on a daily basis. So whether you see yourself as a future engineer, as a data expert, as an healthcare professional looking to innovate, there's absolutely something for you. And I want you to embrace this journey without fear, because one of the things that people are usually scared about is going into a new field where they know nothing about, especially those that are transitioning. They are scared about how to navigate the field. Like, should they just continue with their previous fields? But I want to tell you that you should embrace the learning journey. You should actively look for opportunities, and you should be ready to contribute your unique skills and perspective. So before we go, I want you to remember this simple mantra for your journey, which is learn, build, connect, and solve. You should be bold, build local, and think globally. Never, ever, ever underestimate the power of your ideas and your passion. Thank you all so much for your engagement and your attention. I've shared a lot of information with you all today, and if you have questions, you can ask me. I'm all ears. So you can, if you need further explanation, you can send me an email, you can connect with me on LinkedIn. And I have this monthly health tech updates, but unfortunately, I don't have the link with me now. So I guess we can do that some other time. So we have come to the end of this presentation.
All right. Thank you so much, Dr. Favor. That was such a packed session. I mean, in between, I had jotted down a few questions, but it seemed like as we went on, the next slide would usually answer what I had put down. So that's just to show you how rich the presentation was. Like I said, guys, now we'll take questions or even comments. So you can either unmute yourself to speak or drop your question in the chat. While we wait for that to happen, I did have a question regarding the challenges that, we might face in this sector. So it's just me, diving deeper and just, for example, because I feel like most people on this session might probably still be students or just fresh graduates. So could you just highlight a few things that might sort of like seem to be like barriers to entry when it comes to the health tech sector? So just to touch on that. Dr. Favor, did you get that?
Okay, sorry, I didn't get that. Can you repeat the question again?
So the question was, I needed you to touch on some barriers to entry when it comes to the health tech sector. Yeah.
All right. So some of the barriers to enter when it comes to entering the health tech sector is regulatory compliance, like I mentioned before. So like there are so many different regulations and they are changing on a daily basis. So you need to ensure that your health tech innovation or it's actually meeting the regulatory compliance. Then another issue is high capital, initial capital requirements to enter into this sector, because in the health tech sector you need, like, especially if you are developing software, like you need huge capital to do that.
Okay, thank you. But then despite that, it is still doable, right?
Yes, of course it is.
Okay.
It's still doable. Like I said, like there's nothing that is impossible. So for the initial capital, you can start small. You don't necessarily have to like build a very huge system. You can start small from the little resources that you have and then build traction. After you have built traction, you can then start applying for fundings. Now, there are so many fundings for health tech technology. So you can start applying for fundings. You might not get them initially, but don't be discouraged. You can always get them.
Okay, thank you. Thank you for that encouraging line at the end. So we still want to take some more questions and comments from those of us who are on the call. So feel free to unmute yourself or you can drop your question in the chat.
Oh, okay, I think I'll go with a question.
Okay.
Yeah, thank you very much. I favor amazing session. Thank you very much. I think a quick question would be speaking to the aspect of building in public. How do you encourage someone that, in a sense, has challenge with, always coming out there, you just want to do your stuff, like you want to do amazing stuff, for instance, like I'm doing something around health and my concern is just I want to make the impact, but you don't know how to tell your story. Coming from a perspective of, you mentioned earlier that in 2025, you need to like build in the public. So what helped you in coming out of if you were ever in one, maybe out of your shell? How were you able to tell your story better and things like that? Thank you.
All right. Can you hear me? Hello.
Yes, Dr.
All right.
I can hear you.
So, okay, so first and foremost, you need to start with your why. like, why are you doing this particular thing? I feel like if you understand your why, then it would be easier for you to come out and build in public. Yes, it's actually not easy to build in public, to be honest. Like, sometimes you just want to be in your shell, especially when you see what other people are doing, you are overwhelmed and you are like, oh my God, I'm just still at the starting phase. But when you understand your why, it helps you to build credibility. It helps you to get early feedback from people. And then for me, I feel like when I started this whole journey, I started in university, and I'm really glad that this conversation is actually for university students or recent graduates. So don't just spend your university days going to class, like going to class. It's very important, but then try to look for how to integrate other things into it. Like, look at what is happening in your community, join communities, volunteer for organizations, look at a particular field that you want to go into and look for internship roles in that field. Start building little by little and little by little. And by the time you start building like that, you eventually get to where you want to be. Even if, you know, like, we are all human beings, we are never satisfied. The more you get, the more you want to have. But start small and try to come out of your comfort zone. Like, push yourself out of your comfort zone. You have to keep pushing yourself out of your comfort zone. It's not easy, but you need to try. And the more you try, the better you become. So also, don't be scared that, oh, I actually don't know what to do. I always tell people that do it scared, but do it anyway. No matter how scared that you are about a particular thing, do it. Even if you feel that people are going to laugh at you. Trust me, people are not really looking at you like that. Like, they're not as interested as you think. So even if you make mistakes, I feel like making mistakes is like a stepping stone to greatness. Nobody ever did something amazing. Nobody ever built anything without failing. So failure is actually very important in life. When you fail, you go back to the drawing board and you understand where the problem is, solve the problem, and then you step back on your feet and continue.
All right. Thank you very much for that. It looks like we have a question in the chat, so I'll just read that. Hi, Dr. Favor. Thank you so much for your presentation. I'm currently studying pharmacy. I'm interested in health tech, but I'm not really into the technical aspect of it. I'm interested in planning and organization because that's where I feel like I'm in my zone. Please, what advice do you have for me? What courses should I take? What organizations can I join for free? So, Dr. Favor, if you could help us with that.
I think you should go into project management, the project management field. So since you are not interested in coding, the project management field, what you do is to basically design health tech solutions from start to finish. So you are helping them to understand the health tech ecosystem, providing solutions. Like, you are how do I explain it now? You are collaborating with the other design teams, like the UX UI designers. If Paraventure is a mobile app, the software engineers. So you are in charge of product management. So for the courses that you need to take, like I said, I think I did a slide on that. Let me just go back to that slide. I did a slide on the courses that you need to take. So let me just go back. Okay, so this is it. So for courses, you can take courses on Coursera. You can take courses on Coursera. You can take courses on Google Career Certificates, Microsoft Learn. So those are platforms that you can take courses on. Then for organizations that you can follow organizations such as Design for Health by CC Hub, African Digital Health Summit. You can follow individuals like Dr. Joy. I can't remember her full name right now. and there are so many organizations. So what I would advise you to do is to go to LinkedIn and just type probably project manager in digital health line. So it's going to bring out organizations and people in that field. Then also you could also research. Like I said before, researching is very, very important. You might not actually know what you want until you research. So research about this field, research on all the fields that I actually spoke about, the ones that looked interesting to you. Research on all those fields, understand what like the in-depth things that they do in that field, and then pick a particular field that you want and go through with it. So it's about starting from a particular point. You can never really know what you want until you start.
Okay, thank you very much, Dr. Favor. I really hope that answers your question, Priscilla. Can I just get a reaction? That was okay. She responded. All right, so I think we're good to go. Do we have any more questions or comments? Because now is the time to take them. Okay. Anyway, even if we don't have questions, like I said, it was a really packed session, Dr. Favor, and I mean, I know that we've all taken 1 or 2 or 3 or a lot from it. So thank you so much. So Damilola Alima is asking if you mind sharing your slides, Dr. Favor. Would we be able to get that from you in case we want to go over it? Dr. Favor.
Okay, I was responding, but my mic was not.
Okay.
Yeah, so yes, I could share them. I don't have a problem with that.
Okay, no problem. Thank you very much. So we would share that with the rest of the team. So yeah. And just to add to what you mentioned earlier, for Priscilla and others might be thinking the same, stay active in the ASN, community, and be sure that we would always send, internship opportunities or scholarship or fellowships, or just things you can apply for that can help you in whatever specific industry you're most interested in. Okay, so now we'll take the announcement. I think James would like to handle that. So James, you have the floor now.
Yeah, hi guys.
James? Hello,
Thank you.
James.
Yeah, thank you very much, Amifel. Good to hear from you again. And thank you very much, Dr. Favor. I was in all through, and I kind of enjoyed the session, the exposure to the plethora of opportunities that we have within that industry, health tech, and your slides are really beautiful. Yeah, they're really beautiful, and the way you articulated them really made me connect with them, most importantly. And thank you for the time once again. Thank you for giving back to the African Student Network and the ecosystem at large. So let's just use the reaction to celebrate her, to kind of say thank you. If you can type in the chat box or something. So thank you very much. We really appreciate it. And I'm super surprised that, not super surprised to be fair, but that a lot of people kind of I don't know what's a lot, but we have at some point 35 people were in, and it's quite amazing to see people that are very much interested in health and the intersection with technology. So we really appreciate this opportunity. Just a few announcements. The video is going to be posted on YouTube, and we have a very exhaustive YouTube. If you don't know about that, you're probably missing out on something really interesting. So we have a very exhaustive YouTube where we have different opportunities and different, if you check the playlist side of things, you're going to see that we've talked about a lot of things in the past, and you can basically glean from it, learn as much as possible. We have the Global Internship Insight series that we've done for 2 years now, and these are resources that we have out there for each and every one of you guys to leverage in order for you to improve the outcomes of your life, specifically central to your career, to entrepreneurship, and also leadership. So once again, thank you, Dr. Favor. Maybe before tomorrow, we're going to have this session up there, and yeah, so that we can rewatch and pause and try to make research and glean on everything she said. So a few other announcements. ASN anniversary is coming. It will be 2 years tomorrow, specifically. And yeah, I don't know. Super excited about that. Started in July 2023, just as an idea to kind of like help African students maximize opportunity, like learn about one or two things that could improve the outcomes of their career. And it's becoming movement. We've got like about 1,200 people on 2 communities on WhatsApp. We have like 5,000 people that has overall checked out our programs and joined our content and all those kind of things. So I'm super excited that we're going to be 2. If you are on our social media, like we share the link, please try to follow, give us a subscribe on YouTube. And a lot of you watch the YouTube, but not everybody kind of like follow the YouTube, right? So please give us a follow on YouTube. And yeah, and that helps the algorithm to kind of like recommend it to other people also. So we're going to be having like an event to celebrate our anniversary at the end of this month. I think, if I'm not mistaken, at the end of this month, it's going to be interesting. We have some games, we have some success story that we want to share. We have some couple of people that have been beneficiaries of some of the programs, like the Global Internship Series, that now work for like global and local companies or continental companies in Africa. And we hope to like see all of you there that have been part of this story. It's an opportunity for us to celebrate you guys also. And also ASAP is coming. The team has been working tirelessly to kind of like make sure that it's a success this year. Started last year, we were able to get 50 people certified in the African Student Accelerator program. So please, when it comes out, the registration is going to be tough, I think. So try to apply as soon as you can so that you can get some sort of like priority, indicate you're part of the community. That gives you like an edge somehow. And also follow us on all our social media. And yeah, I think that should be all from my end. Specifically, thank you once again, Dr. Favor. We really appreciate it, and we do not take it for granted. Take care. Cheers. I'm Michelle.
You are
All right,
welcome.
thank
I
you.
was very excited to join this session and give my insight.
Yeah, cool. Thank you. Probably give you a follow on LinkedIn. Thank you. I'm Michelle.
Yes, thank you so much, James. Again, thank you, Dr. Favor. Like I said at the beginning, I'm always happy to have ladies come on here and speak to us. So, and I mean, you were here, you delivered so nicely. So thank you so much. For coming to share all of this with us, not just to her on LinkedIn, and I believe she'll be sure to help you out with your inquiries. So thank you all so much for joining today's Insight series. We hope to have you, in these numbers and more at our next, sessions, because they're always so packed, like I say. So next time, my name is Amifel Eribo, and it was wonderful being your host, and I wish you all an amazing rest of the day. Thank you.